Hi, I'm Harpreet Bajaj. I'm an endocrinologist in Toronto, Canada. Today I'm going to talk about recreational cannabis use and how that may impact diabetes. So we know that recreational cannabis use is a growing issue. In Canada, cannabis or marijuana, as it's popularly called, was legalized. This was last year, just about a year ago now. In other countries, maybe in some provinces in the United States, there is recreational cannabis that is available, but also available illegally and being used, as we know, in most of the parts of the world. So, cannabis use and diabetes is a topic that is not often discussed or known. There is actually a dearth of evidence as well as literature. And for us healthcare providers, there's always this kind of knowledge gap as to how this may impact those people who have either type 1 or type 2 diabetes, and how should we counsel them. So Diabetes Canada, we came up with our position statement. This is the first position statement that has been made in this specific issue, that is cannabis use, recreational cannabis use in people with type 1 and type 2 diabetes. And here's a link for that as well. First of all, before I say what the position statement said, I would caveat that by saying there is limitation of data. High-grade evidence does not exist when it comes to cannabis use and how it may impact either glycemic control or self-care behaviors among people with diabetes. However, most of the data that exists is observational cohort studies, and is lower grade than what we would like. And with that caveat, what the Diabetes Canada position statement states is, I think, important and should be taken into consideration when we are discussing this with our patients. So the first point is that glycemic control in people with diabetes was found to be somewhat worse, in addition to self-care behaviors, which might tie into the glycemic control. Self-care behaviors as to glucose testing, following instructions, taking their medications, those kinds of behaviors may get impacted among those who use recreational cannabis on a regular basis as such. And that may impact our glycemic control. There's also low-grade evidence that this might then impact some of the complications that come from that glycemic control, or that worse glycemic control that might happen as well. So there's some evidence linking complications to those to marijuana use in people with diabetes as well. The other thing, and maybe this is the last part, and maybe the most important, among people with type 1 diabetes, there's also evidence that suggests that there is an increased risk of diabetes ketoacidosis in those people who use marijuana, cannabis recreationally as well. So that last piece, of course, DKA or diabetes ketoacidosis is one of the complications, one of the dire complications of diabetes that we worry about, and that has been found to be increased as well. So the practical point, what should be the take home for a healthcare provider from all of this? I would say, first of all, discuss this with your patient, either with type 1 or type 2 diabetes. Just similarly to when we talk about, do you use alcohol, ask them in a non-judgmental fashion, do you use cannabis or marijuana? And then discuss within the limitations of the literature that there might be potential harm to using cannabis in terms of glycemic control, self-care behaviors, and potentially some complications, including DKA in type 1 diabetes. Final word I would say is individualize that counseling that you provide. Of course, you know your patient, and we need to approach each individual patient in a certain way. And so make sure that we individualize that education piece to the benefit of the patient who's sitting next to you as well. So I hope this was a useful information. I'll be back with another sugar beet video or commentary in the near future.